I came out in the early 80s when AIDS and HIV was not talked about.
3/4 of our infected cases are in Africa. And when the burden is that deep, when it's that severe, there's just so much to be gained in one area.
Destigmatizing testing, I think, is important, and getting people tested regularly and into care if they're infected. For both, treatment is prevention and prevention is treatment. They're not separate. I was working in hospital infection control in 1981 when these first reports came out, and I remember pretty quickly thinking we have something really major going on here, because to see the level of immune suppression that these men were experiencing when they were actually presumably healthy meant there was a lot going on underneath that we didn't know anything about.
Things started to go really bad. Then I started running a fever and got really sick, and I kind of knew in the back of my head that what was going on, but I didn't want to know. So I went to the emergency room at Mount Sinai Hospital in Miami, and I'll never forget it. I called my stepmom and my dad and finally told them just over the phone, look, I have AIDS and I'm kind of coming home to die. And I think that's what they thought.
We have not been as successful as we need to be at preventing sexual transmission. That's where most transmission happens. There's a lot of sexual transmission between men, and there's a lot that we don't know about how to stop that transmission.
Let me focus on Africa, actually. That's where my work lies. And in the last 30 years, well, there wasn't a lot of progress in Africa at the beginning. So all the emphasis, really, all the great progress has come in Africa in the last 10 years, I would say. And the great success, look at 2000, there was almost no one in Africa, in any poor part of Africa, which is the majority, on antiretroviral therapy. What do we have in 2009? We have almost 4 million people on therapy.
I think people forget that we've done an excellent job at preventing and minimizing mother-to-child transmission. We've also virtually eliminated bloodborne transmission, which was a big issue in the early 80s.
I think there's much to be done in Europe and in the United States and South Asia, no question. But the majority of our problem, when you look at HIV/AIDS, the majority of the problem is in Africa. And again, if we focused on strengthening the health system, all these multiplier effects would spread out. So we improve, child well-being for kids who don't have HIV/AIDS. We improve vaccination rates. As I said, we improve cancer treatment. So many health needs are present in Africa. If we used the AIDS money to improve the health system, we would have all kinds of positive effects.
I think that for some people, they think, oh, it's just a disease, it's not a big deal, I'll just take a pill the rest of my life and I'll be fine. I think that really underestimates how difficult it is to be infected with HIV. We've had highly active antiretroviral treatment for about 15 years now, which means that we don't know what it's going to be like for people who are on these medications for 20, 30, 40 years. We don't know the effects of being infected for 20, 30, 40 years. Preventing infection still needs to be urgent.
I'm in the process now of going to school and getting my degree so I can get off a disability. That's how good I'm doing, but it took me a while. I'm still taking antivirals. Revealing my status is much easier for me today. That was always difficult for me. I absolutely think they'll find a cure for this in my lifetime. I don't know if we can call it cure. I don't know that the virus itself will, you could take a magic pill and you'll suddenly be HIV free, but I know people are going to be able to live with this. I think through education, if we really stick to the prevention education that organizations like HARC are so great at promoting, I really think the education is going to take care of this.